Hello and welcome to this Institute for Government event to discuss how the government can level up the nation's health. I'm Gemma Tetlow, the IFG's chief economist. Levelling up is the big ambition for Boris Johnson's government beyond coronavirus. One important aspect of inequality between places in the UK has for a long time been the differences in health. That matters for people's well-being, but also for their productivity at work and the demands placed on health and social care services. So I'm delighted that you've all joined us today to discuss the crucial question of how we can level up the nation's health and what role for government and business in doing that. We're very grateful to Legal & General for sponsoring today's event. To help us discuss these questions, I'm delighted that we're joined by a fantastic panel today. Jo Bibby is the Director of Health at the Health Foundation, responsible for leading the Foundation's Healthy Lives strategy. Professor Sir Michael Marmot is probably the UK's most prominent advocate for tackling health inequalities, leading the government commissioned Strategic Review of Health Inequalities in England in 2010 and a recent update, the Marmot Review 10 years on. Tina Woods is a social entrepreneur and founder of various ventures to drive systemic change in health, including Business for Health, a social enterprise to help businesses maximise their positive contribution to the nation's health in a sustainable way. And Nigel Wilson is Group Chief Executive of Legal & General and also a member of the Prime Minister and Chancellor's Build Back Better Business Council. And we're very grateful to L&G for sponsoring this event and look forward to hearing from Nigel about the thinking that L&G have been doing about the role for the private sector in levelling up health. A few brief housekeeping notes before we kick off. Please do start sending in your questions via the Q&A function. And if you're happy to do so, please do add your name and where you're tuning in from. It's always good to know who we have on the other end of these events. We'll be live tweeting the event from the @IFG Events Twitter account and using the hashtag IFG Levelling Up. So please do follow and tweet along. Today's event is obviously on the record and the video and sound recording of the event will be up on our website within 24 hours. But before we hand over to the panel, I want to hand over to my colleague, the Director of the IFG, Bronwyn Maddox, for a few opening remarks. Bronwyn.
Gemma, thank you very much indeed. I just wanted to say a few things at the beginning about why we're so pleased to be doing this event and doing it with L&G. Levelling up is one of the government's main priorities. We hear about it a lot, and it promises to shape the policy landscape as the country and the economy recovers from coronavirus. And yet, as it stands, levelling up can mean all things to all people. As the government works to clarify what it means by levelling up, we at the Institute for Government will be doing a lot more work on what we think it means and how the government can achieve its aims most effectively. So we're really delighted to be partnering with Legal & General to put on 2 events on this topic of levelling up over the next week. On Monday, we're going to be joined by Peter Mandelson and Rachel Wolfe to ask, what does levelling up really mean? And I'd encourage you to sign up for that event if you haven't already. And then there's the discussion we're about to have now. Given what we've been through over the past 15 months, it's really appropriate that today's event is asking what role improving public health should play in that levelling up agenda. The pandemic's affected different groups and areas very unequally on top of existing large health inequalities. The important question, and the one before us today, is what the government can do to level up the nation's health as well as the role of business. I look forward to hearing answers to this from the panel. I'll now hand back to Gemma to start the discussion. Thanks for joining us.
Thank you very much, Bronwyn. Michael, let me come to you first. You've researched health inequalities in the UK for several decades. How important is it that health is a central part of the levelling up agenda for the next few years?
If you look at the report we did with the Health Foundation, the 10 years on report that we published just before the pandemic struck, what we reported was that health had pretty well stopped improving over the last decade. Health inequalities increased and life expectancy for the poorest people outside London was going down. This was a terrible situation. And then the pandemic struck and made all of that worse, which is why we called our second report of last year, Build Back Fairer, put equity of health and well-being at the heart of all government policy. So what can the government do apart from putting equity at the heart? We had 6 domains of recommendations in my 2010 report, which we renewed in the 2020 reports. Give every child the best start in life, education and lifelong learning, employment and working conditions. Everyone should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work, including housing. And number 6, taking a social determinants approach to prevention. So we really know the causes of ill health and health inequalities. Building back fairer or levelling up needs to invest in those 6 domains in an equitable way.
Brilliant, thank you. Joe, I'll come to you next. The Health Foundation has proposed a cross-government strategy to promote public health. The government's levelling up agenda is largely focused on economic regeneration. What are the spillover benefits of better public health on the economy and well-being?
Yeah, thanks, Gemma. Well, I think we know from our own experiences, good health is an enabler of our ability to participate in work, in our communities, and in family life. And when you look at the stats, a third of working age adults in the areas with lowest healthy life expectancy are economically inactive. So by having poor health in the population, that's acting as a brake onto the sort of economic levelling up, which the government wants to achieve. Similarly, 43% of unemployed people report having poor mental health. So we see how poor health becomes a barrier to participating. So if the government wants to level up the economy, it can't do it without levelling up health as well. And I think the sort of bonuses is that it's not an either or, it's not health or the economy. We've seen that over the last year and a half. If we have good health is necessary to economic participation, but if we can create a good economy, we can also improve health. But I think one of the things that has to be paid attention to is that levelling up the economy won't lead to benefits in health unless we do it in a conscious way, unless we really make sure we target the areas of greatest need, that we look at both inequalities across local areas and within local areas, because even in the wealthiest of local councils, we see people experience inequality. It's not just a sort of broad geographical thing. We also need to make sure that the levelling up agenda invests in the things that create the conditions for good health along the lines that Michael's been talking about, closing the attainment gap, good quality work, supporting communities. And I think the other thing is what we've seen is that there's a lot of remedial action needs to be done now. It's not just something we can solve through forward investment. We need to have the remedial action to address in-work poverty, to improve our food environment, and those kinds of actions where we actually just have endemic problems at the moment in our society.
Thank you. Tina, you supported the all-party parliamentary group on longevity, and they recently proposed that the government should adopt a health improvement plan. What should be the priorities for that plan?
Yes, I hope everyone can hear me. Yes, so the Levelling Up Health report was a follow-on report to the initial one that we launched actually just before COVID called Health of the Nation, and done by the All-Party Parliamentary Group for Longevity, which effectively has acted almost like an incubator of ideas, and we're sort of springboarding from that to actually execute some of the actions that are in the report, which we'll come on to in a second. But in this particular report, we've essentially build on the overall sort of mission that we have set in terms of the manifesto commitment on 5 extra years of healthy life expectancy while minimizing health inequalities. And of course, a lot of it has built on Sir Michael's work. And indeed, we worked with the Institute for Health Equity on the initial report. But in terms of the priorities that we laid out in the Levelling Up Health report, and we launched it a couple of months ago with support of Matt Hancock, our Secretary of State, Chris Whitty, CMO, and Henry Dimbleby, who's of course about to come out with a national food strategy. And it really was around who supported the framing and the ideas, and it was really around the ambition and to recommit to the healthy life expectancy while minimizing health inequalities goal. We call it HLE +5 for shorthand. And we needed, we also wanted to have a more, I guess, a pragmatic approach in terms of focus. What can we achieve in the short to medium term in terms of the Levelling Up Health agenda, and looking at the worst health in 5 key areas, which were smoking, clean air, and of course obesity, clean food, and healthy children. And of course the last 3 are quite linked. We also wanted to present the case for change, and I know Joe spoke to government action, across departments. So we have ideas around that in the report. But we also proposed a health improvement plan and fund, a 10-year sort of plan to improve the health of communities. And actually have initiated sort of what we felt the fund could look at, essentially offering essentially consisting of a 5-year partnership to improve health, working with the 60 local authorities around the country that are in most need of the support in terms of the data on health inequalities, worth about 10 million a year on average. This is all spelled out in a report which you can look at on the APPG for Longevity website. But essentially, and of course we know that we also need to focus on making a credible case on getting the most value out of that money. So, but also Joe spoke to this as well. We need all government departments to focus on this. So it's not just the Department for Health and Social Care, because that's the mistake that we often fall into, is that it's the NHS that has the whole solution. So there's a whole program of work around how do we, and this is actually what we're discussing at the moment with our colleagues, how do we do that, especially in the run-up to the formation of the Office for Health Promotion, which shouldn't be seen as just being owned by the Department of Health and Social Care. It needs to be a cross-government initiative. So we've got a number of key projects that we're now tabling and trying to secure funding for. And these are very, very briefly, we'll come on to sort of this in more detail, I'm sure, in the course of the discussion around central local partnerships. We know the axis is moving towards local, NHS commitment around preventative health metrics, and we've got a whole ideas around that. The Business Coalition for a Healthier Nation, which is now called Business for Health, which has been set up, launched in November, and of course Legal in General and the Health Foundation are very involved in that, as indeed many other partners. And some ideas around forming charities for change and also getting more cross-party support. So those are the top line sort of headline sort of projects, but I can go into more detail as we go into discussion.
Thanks, Tina. And Nigel, what do you think the role should be for businesses and investors to improve public health and refrain from actions that perhaps harm public health? And how similar is that to the focus on green investing that's obviously become a very big topic of debate as well in recent years?
I'll take those in reverse order and just talk about the evolution of climate, because I think there's some good and relevant lessons. I mean, there have been 3 great reports which I'll refer to. One is Michael's brilliant report in 2010, Nick Stern's on climate change with Adair in 2006, and the Stevenson Farmer report on mental health, which I'm sure everyone's familiar with. But it's how long it takes from great reports into making good stuff happen. And we have developed a sort of pledging culture and not a doing culture. And I think what we need to do at a big picture level is move to being a doing culture. And we, as probably the biggest investor in the UK, kind of want it to become a doing culture so we can really make a difference. I think that's point one. I think there is, to a certain extent, there's some enlightened self-interest. The cost to business of sickness and absence is 90 to 100 billion. Stevenson Farmer estimated mental health costs 30 billion pounds per annum, which I think is a fairly accurate. Type 2 diabetes, 10 billion pounds. All of these things cost a huge amount of money. So there's enlightened self-interest for really getting involved. As part of our purpose, and I think the purpose of many businesses is edging more towards having a purpose, and therefore inclusive capitalism rather than exclusive capitalism. And exclusive means the rich have got richer, they've got better health, they've got better education, they've got greater, they've retained lots of stuff, whereas the poor have got worse, as Michael and others have mentioned in the points that have happened so far. So there has never been so much money available to invest in, and we all readily accept science and technology is changing in a really profound way. It's the most exciting since the 1850s, 1860s, and so there are amazing scientific and technological solutions to lots of health issues that we need to address, and we're really excited about investing in lots of those things. Energy is now clean, green, and cheap. And it's the cheap bit that's actually driving much of what we need to do. but lots of health stuff is also the equivalent of clean, green, and cheap because of the use of technology, and technology has improved immeasurably. And we've seen a great example of that in the pandemic, how quickly we can energize science and technology to work together to deliver amazing outcomes. That should be the model going forward, that we get things done quickly. But we need policy for that, and I think, you know, as Joe and Tina said, there's lots of changes that need to happen. The solutions are on the shelf, and it's a bit like climate change. The solutions are on the shelf. The technology is here. The solutions are on the shelf for lots of this stuff, but we need to do them. I have absolute conviction that lots of these things are investable. There's lots of great solutions out there. Our partnership, you know, with many, you know, with different organisers, whether that's Oxford University or Edinburgh University, the science is staggering, the technology is staggering. So all the preconditions are in there. So some of the debating needs to dial down, and a lot of the doing needs to dial up. And the corporates and the people who, you know, have amassed amazing amounts of money. There's an amazing amount of money, and there's lots of good corporate goodwill, and there's lots of great ideas. We do need a bit of policy nudging by the government to really, you know, step up. And we've heard a lot of talk about that, and I've had the privilege of attending lots of those meetings where there's been a lot of talk about it. But it definitely is. We need to become a doing culture here in the UK.
Thank you, Nigel. Michael, can I come to you with my first question, and I'll come to the other panelists as well. To what extent do you think that coronavirus has changed the health inequality challenges that we face as a country, or has it just reinforced issues that were already there?
The pandemic and the societal response to the pandemic have exposed the underlying inequalities in society and amplified them. We see it particularly with ethnic groups, the very high mortality from COVID-19 in Black African, Black Caribbean, Bangladeshi, Pakistani, and to a lesser extent, Indian. So it's amplified those underlying inequalities, has brought them to the surface in a way that we must not ignore. And then, of course, the societal response, lockdown. I'll mention the IFS, Gemma. Look at the IFS figures. The lower the household income, the more likely is somebody to be employed in a shuttered sector, in a sector that's shut down. So people of high income can continue working, work at home. People of lower income are either exposed in frontline occupations, and we see that in our Build Back Fairer report, or they're out of work. The furlough scheme made a huge difference, but we've got all these problems building up. And just to take one extra indicator, things I haven't mentioned, look at depression and or unhappiness, particularly in young people. It rose during the pandemic, and particularly in young women did it rise during the pandemic. So the problems of inequalities have been exposed and amplified, which is why paying attention in Building Back Fairer is vital.
Tina, Nigel mentioned the sort of self-interest for businesses of wanting to improve the population's health. Do you think the pandemic has actually made businesses more aware of that, how reliant they are on a healthy workforce to be able to continue their business?
Yes, absolutely. I mean, it's very interesting because, of course, when we were first scoping out the idea of the Business for Health venture as part of the All-Party Parliamentary Group discussions, it was at the height of lockdown, in the first lockdown. So, of course, business were having to rise to the challenge, and of course, they had to sort of seize, develop their role in terms of helping their employees and their workforce in dealing with the pandemic. And of course, they have had to absorb also the consequences of the pandemic. I mean, we can, Sir Michael just pointed to depression, for example, musculoskeletal conditions. I mean, these are all the sorts of things that are really impacting the workforce now. And of course, all the conditions that have put us at risk of chronic diseases and ill health. These are the sorts of things that have certainly sort of come to the fore during the pandemic, but of course are also hitting business and of course productivity. These are all the issues that have really sort of ignited attention for business now coming out of the pandemic. They have to essentially sort of raise their role in terms of dealing with the consequences, but in a way that's proactive and can deliver what we need to ahead.
Jo, you mentioned in your opening remarks the need to address inequalities both within and between areas. Obviously, the government's levelling up agenda has really predominantly been phrased in terms of helping areas that have been left behind. Are you concerned that perhaps the levelling up agenda could end up overlooking or resources not being allocated to those who are in poor health within otherwise better off areas?
Yeah, I think there's a risk of that. But I suppose it's what do you think about in terms of the funding available. So there's obviously there's the new funding available and there's the existing government spending. And I suppose what we need to make sure is that both of them are being aligned with the need that exists in different communities. And we need to be making sure that the kind of the formula that sit behind allocations take into account overall levels of inequalities and within area levels of inequalities. We also, I think, need to have mechanisms in government where policies that are being developed by different government departments build in much more explicit consideration of how what they're proposing can contribute to improving health and improving the conditions that are needed to promote good health. So I think it can be done, and there needs to be a conscious effort to make sure that we don't inadvertently leave some people further behind through kind of, too superficial thinking about what levelling up means.
Tina, you talked about that the APPG had highlighted 60 areas, I think you said there were 60 local authorities that were most in need of support to help with health inequalities. How do those overlap with the sorts of areas that have so far been prioritised for the government's explicit levelling up funds?
We'll have to obviously identify those particular, local authorities who do need the most support in terms of the data. But clearly these are the areas that already have been spotlighted by, for example, the ONS indices. And of course, they're now developing this overall sort of health index, which will be really interesting to see that come about, because of course they're measuring health more from an asset-based perspective, healthy lives, healthy people and healthy places. So that will be another interesting thing to keep track of, because that will give us much more granular sort of information on where the areas need most support. We've got coastal areas, obviously rural areas that need more support. So the data will show us where which of those 60 areas need the most support, and could essentially be incentivized to make use of additional funding to help resolve their local issues. There are going to be sort of shared problem sets across the country, which could be essentially looked at, that might be applicable in a sort of more sort of national sort of approach, but essentially the data will show us.
Nigel, I guess the backdrop to the next few years is, despite government plans to hugely increase investment spending and they have big ambitions, there is going to be a limit to what government can do in this space on its own. You talked about the role that business could play and the sort of conditions that need to be put in place for that to happen. What are the particular things you would be looking for the government to do over the next few years that would really facilitate business doing what they can in that space?
Part of it is get out of the way. I mean, everybody's, the solution to everything is government does this, government does that. In my life, it's not been that case. Is that lots of stuff, and we think of government as being the minister who typically is in the job for 18 months or 2 years, when these are the long-term profound changes. We're great fans of devolution, and devolution means local governments and whatever have a bigger role to play, in whether it's Sunderland or Newcastle or Manchester or Bristol or Oxford. Everywhere is health inequality exists, and so we need some innovation and investment at a local level to create exemplars. Because if people see things that happen and deliver great outcomes, they'll copy them pretty quickly. And what we've seen since Michael's great report or the work on climate is not enough real doing around stuff. And so we'll certainly be working on a few specific areas of the country rather than the whole of the country to try and create exemplars with willing people. You know, we have an ease of use framework with local authorities and cities across the UK, to be frank, is that who actually wants to do stuff and get stuff done, who wants to debate it, and how do we then achieve these things. Clearly around policy nudges, you know, Henry Dimblby's food strategy and stuff like that is very important, and I think that you need that contextual policy background, because, you know, people need to eat better. And, you know, I know that sounds excessive, but that's the truth, is people do need to exercise more, all those very simple things. And we need, you know, the health system not to be predicated on late intervention, but it's actually on prevention. And we all know all this stuff, but we're not doing enough of this stuff. We'll find areas of the country where we've got willing people who want to make a difference and get stuff done, and with Michael's support and others' support, we'll make good stuff happen. You know, we've invested 30 billion so far in urban regeneration. We're going to invest another 30 billion. We're going to invest, you know, tens of billions in climate change, and the whole area of health is so important. You know, we've set up a health and tech subdivision within the business now, so that we can address that. Mental health, we have as many mental health first aiders as physical health first aiders, because in one sense they're equally important in the workplace. And there's lots that people can do, and we'll use our convening power. You know, we own between 2 and 5% of every company in the UK. You know, lots of people are our customers, and so we want to use that convening power for good and bring people together who are like-minded and want to get things done at a local level. And, you know, having Tina and Joe and Michael and many others really engaged in trying to deliver great outcomes, because it's the outcomes that matter. You know, Michael could write another great report in 10 years' time, but he won't be happy if the outcomes haven't changed a lot in the last 10 years. And the disappointing thing about the first report is there's great stuff in there, but not a lot had happened. In fact, we'd gone backwards in the 10 years since Michael's first great report. And Nick had a bit of that with climate change, is that he was shouting from the rooftops for a long time. I think Dennis Stevenson is the same on mental health, is that we haven't been doing enough. And so we're definitely going to be working like-minded people who want to make a difference, doing it at a local level, you know, whether it's the 60, the 30 or the 10 local authorities that really we can make some difference in. That's what we'll be doing.
Thank you. Michael, there's quite a lot of emphasis, or some emphasis at least, in the government's levelling up agenda about creating places that people want to live, that they're proud to live in. But from a health perspective, what makes for a place that someone will grow up and live healthily in, and are there more things government could be doing to prioritise that?
It relates to all 6 of my domains. We know quite a lot about healthy places. I mean, let's take very basic housing. You can't have a healthy place unless you've got decent housing, decent shelter to live in. So housing is vital. I mean, the visible end is rough sleeping. Next is homelessness, and then insecure and substandard housing. We know the importance of taking a green approach, which means transport should be walking, cycling, and public transport, absolutely vital. Local amenities, essential. Social capital, social relationships, the relationship of the school to the home, and I didn't leave it to last because it's the least important, but it's vital, and it's what Nigel's been talking about. Workplaces, that you do have work in your community. And as we've been working with Greater Manchester, now Cheshire and Merseyside, we've been talking to north of Tyne. These are areas that have really suffered because of loss of employment in the past. And it's very difficult to have a healthy place unless you've got good work available for people, so they don't have to leave to get work, or swapped decent jobs for the gig economy. So work is a vital part. And let me say just one other thing that's really bothering me. I really like Nigel's formulation. We've got good ideas. There's money. We now somehow need to put the two together. Let's not forget the money, though. I mean, was it last week that the government's advisor on closing or reducing the educational divide had a report, the government's saying all the nice words about levelling up. And the Prime Minister is a classical scholar, so he knows what decimate means. And he decimated the proposed budget from 15 billion to 1.5 billion. So we can talk nice language about levelling up, but it does take money. Money, yes, from the corporate sector, local government, but the national government can't get away from the fact that they have to have convening power, but they need to put money into it too.
Thank you. Tina, Michael sort of touched there on some of the political challenges of making progress on this agenda. From your experience working with the APPG on longevity, what political challenges did you come across? Is there broad cross-party support for this, or where are the what are the blockages in getting this moving forward?
I think what I have experienced and what I've seen, and you know, where I have actually interfaced and have been involved working with the All-Party Parliamentary Group, and Damien Green is our chair and Lord Filkin has been a driving force behind a lot of the work that we've done, is the importance of seeing everything that we're doing in context of all the other stakeholders that we have to work with in collaboration to drive change. And I think to Nigel's point about the sheer pace of innovation, for example, I think it's really, really difficult for any sector, for politicians, for business, you know, for any sector to really keep pace with just the sheer magnitude of innovation that is taking place. I mean, we focus quite a lot within the All-Party Parliamentary Group, for example, on innovation, the data space, and how we have to really look at data differently and harness data, you know, differently to really develop the sort of products and services that will keep us healthy and well. So there's a whole piece of work around that the Health Foundation is involved with, called Open Life, for example. But you know, the sheer pace of change that is going on, politicians to keep abreast of, and also looking outside and looking at the perspectives from business, working from, you know, looking at the perspectives from scientists, you know, all that needs to be done. And I think what the APPG has done really successfully is, you know, we are a doing machine, you know, to Nigel's points about the doing, we're bringing various sort of stakeholders together. So I think the biggest challenge is culturally, and just bringing people together to look outside their four walls, and then being able to synthesize everything in a way that will really deliver the impact. So a lot of what we have tried to do is to say, hang on, let's bring everyone together from multiple different groups, you know, the political sphere, other stakeholders, really look at where we can drive the impact. And that's a difficult process, and it takes a lot of, you know, bashing heads together in a very, very agile way to actually drive through and focus on what's going to drive the impact. So what we've tried to do with the reports is saying, listen, hang on a second, how are we going to achieve this HLE+5 mission, you know, with all the stakeholders that need to be involved? It's not just NHS, it's not just government, it's all of us working in collaboration. So you know, so the cultural piece, breaking down the silos and collaborating together is the main challenge, but also the biggest opportunity.
Joe, your work has also emphasised a similar sort of point about the need for cross-government working, because this really does touches on so many areas of what government does. How can you say a bit more about how you think that could work? How can that be made more effective?
Yeah, so we've been doing work on this, and what we've been thinking about is both the mechanisms you need within government and then the policies that you need. So on the mechanisms, first of all, as Tina's articulating, there does need to be a goal that the government is aiming towards. We need to have some form of overarching goal and then targets supporting that. But we have to also, I think, look at that across a broad basket of indicators, because what we know about improving health and reducing health inequalities is, you know, there are areas where you can get some you know, sort of initial impact and you can show benefit. You know, we know that action around perinatal care, for instance, we know action with certain health conditions and diseases can show some gains and benefits, but that doesn't necessarily get into the sort of more underlying and longer run problems that we have of poverty, obesity, poor housing and so on. So we need a broad basket of indicators that will incentivise action across a full range of activities and not skew towards any particular one. We need that coordination across government. I think Tina said right at the beginning, this isn't just a Department of Health and Social Care responsibility. Most government departments have got a role to play to contribute to create the conditions that can support healthy lives. So that has to be coordinated in some way. And we've been looking at other big initiatives that have been successful, and they usually do require some leadership from Cabinet Office or Treasury or some one of the parts of government that can really bring people together. We've talked about funding, which is clearly important, but the other thing is this has to be tracked. You know, this has to be tracked in a meaningful way, and we think there needs to be some independent assessment of what's happening with the population's health. In the same way we have independent scrutiny of the economy, we need independent assessment and scrutiny laid before Parliament of what's happening with the population's health. Because what we don't want to do is exactly find 10 years on, you know, we have another report and nothing's changed. And so this needs to have attention and scrutiny.
Thank you. I'll go now to questions that are coming in from our audience. And the first one is from Peter Williamson, who asks, given that the UK has a poor record on public health and gives great priority instead to health care, what, if anything, is likely to trigger greater priority being given to public health? And I think, Nigel, that's actually something that you touched on in your opening remarks. I don't know if you have any thoughts about how we can shift this focus.
Part of the shift in focus would be somehow that there's a cabinet minister who's going to step up and make lots of great stuff happen. There's not lots of evidence that that's the case, and I think it is breaking it down into solvable bits of it. You know, I think, you know, the situation around analysis around diabetes, dementia, depression, and everything's all fantastic. It's the doing bits, and we've got to break that down into, you know, local authorities or cities or corporates. Who are very prominent actors, and how do we reshape their behaviour to make them accountable and responsible for delivering, you know, improvements in health and building the right places and all the rest of it. The CEOs I meet, the local people I meet in the cities, the health professionals in those cities, all want to do the same thing. And as we heard, in education, the right number is 15 billion, they're going to do 1.5 billion. And we'll have this constant debate, it'll take longer and whatever, is that we do need action at a local level. And we need cities and towns and the corporates within those cities and towns who to step up and really step up. And it's enlightened self-interest just to stepping up, because 90 billion on sickness is a big number. And, you know, we want, you know, health and well-being is a really important part of our strategy for all of our people. And we want them to have a purpose, but part of that purpose is that their health and well-being is good in the workplace, and the workplace has to be a prominent part of what the solution is. And yes, you know, in a sense, the government can play a very important role, but every other sentence can't be lived with the government this, the government that, because that's not necessarily the way to get stuff done. I mean, I think the government can have policy nudges and facilitate and shape things, but we do need, you know, more than that to you know, get the right amount of money. The world is awash with money. The UK pension industry in the UK has £6 trillion, much of which is looking for a home to invest in. These are enormous amounts of money across the world. We have negative interest rates in large parts of the world. We've got to come up with practical solutions which allow that money to be recycled. But as I said, the science and technology around some of this stuff is off the scale. You know, the fact that we've got vaccinations for the pandemic, like that, in so quickly. There's tons of great off-the-shelf solutions. We've just got to make them happen.
Michael, I'll come to you with the same question. How do you think we can shift the focus from acute healthcare back to public health?
Well, in my 2010 review, we pointed out that public health spend was about 4% of the health spend, and we said it should go up to 7%. I can't for the life of me track back to how we came to 7. I think we probably thought that if we said double it, that sounded arbitrary. 7 sounds really scientific, but so I can't remember how we got from 4 to 7. But the government did the opposite. After establishing Public Health England in 2012 and moving public health into local government, it took £800 million out of local public health and reduced Public Health England's budget by 40%. So we disinvested. There, I made this great recommendation, improve it by 75% or something, from 4 to 7%, and it went down dramatically. Now, Nigel's made the case, I've made the case, Joe and Tina have made the case that public health isn't only about organised public health. It's about all these other things that affect the health of the public. But organised public health does have a role to play. And the good news is we're not as bad as the United States. I've just read Michael Lewis's book on the pandemic in the US, and they don't have a public health system. I mean, a complete failure, a fragmentation of little entities all around the United States with no organized system. We do, thankfully, have an organized system, and we starved it of resources. So we've made it much more difficult for it to function. And just to repeat, it's not just for organized public health. We need local communities, we need local government, we need the corporate sector, we need the voluntary sector, we need all of these different sectors. But organized public health has a very important role to play, and it can't play that role if it's starved of funding.
Joe or Tina, do you have anything to add on that?
Yes, I mean, I would only say absolutely everything and vouch for everything that Sir Michael has just said. But I think the additional complication of you comparing, for example, the UK and the US, I mean, we in Europe, the UK fared the worst in all of Europe, you know, as a result of COVID. And that is despite the fact that we have a public health system compared to the US, for example, which also fared very poorly. So there's something else. And I think one of the challenges that we have as a nation is that we are so we think that the NHS is going to be there to pick up all the pieces. So we have to get out of that mindset. So there's a whole cultural piece that is actually the most difficult thing to wrestle away. We have to think differently. There has to be a more proactive approach, just generally across all stakeholders in society. And I think, you know, I think COVID, what the good thing about COVID, if I can say there have been some silver linings in a sense, despite the tragedy and the horrors that we've seen with COVID, is that it has really focused public attention on how important their health is. We've seen, you know, the consequences, and I think people are really starting to see the link with, you know, wider societal prosperity about why health is so important. So I think we need to grab that, we need to bottle that up really quickly before that dissipates, before we go back. You know, clearly we've got some massive challenges. We've got a chronic disease epidemic actually, and it's now, you know, it's been racking up. So we have to clear the deck. But we need a long-term focus, and we need the public behind us as well, and to stop thinking that the answer to everything is to build more hospitals, because it's not. It's an unsustainable model. We have to move towards a more preventative model, which is why the business community is so critical to this. And to Nigel's point, we need to see long-term patient capital flowing into this space with much longer-term time horizons than would ever be that. You know, the NHS and government, they work on very short time frames and budgets. We need a much longer-term view, and this is where the business community and the capital that exists in the trillions that Nigel was talking about, we need to make sure it gets to the right places to get the impact.
Joe, did you want to come in as well?
Yeah, I think Tina's really put her finger on something important there in terms of the sort of public understanding of what makes us healthy, and the work we've done at the Health Foundation, which it's very clear that the public do think the NHS has this absolutely sort of critical and sort of paramount role, which it does when we're ill, but less so when we're thinking about what makes us healthy. And I think the other challenge that we have with public understanding is that, you know, the public tend to think, you know, that it's about individual agency, that it's about, you know, me making the right choices. And there's less understanding and recognition of how much some people's choices are constrained compared to others, and what that then means to what they're able to do. So I think this public understanding point is really important. I think one of the things we have seen over the last year and a half, though, is the absolutely central role that directors of public health play in local government. And I know that on the back of that, directors of public health are much more prominent. And I think building on that opportunity in the recovery and drawing on their expertise to think about how to sort of build that better approach embeds public health considerations is important. And on budgets, I mean, we've done work at the Health Foundation looking at the public health budget, and you know, it is terrible how it's fallen behind. It's not kept pace with NHS spending, even if, you know, you just use that as one marker of what you might need. But I think the other thing to think about is what's happening across all of government spending, where because we're not making the investments in stopping things going wrong in the first place, more and more money, whether it's in housing, whether it's, you know, in the criminal justice system, whether it's in education, it's going into the things that are fixing the problems rather than putting it into the areas where we can invest and keep people well and contributing to society in the first place. So I think there has to be much more scrutiny of where government money is going and make sure more of it is going into that kind of investment in our population rather than, you know, just kind of patching things up when they're going wrong.
Thank you. The next question I'll take covers a topic that we actually haven't touched on at all yet, which is tax. The questioner asks, given the fiscal position, should we be advocating tax measures to promote health? So things like increasing alcohol duties. What do you all think about that as a possible way forward to try and promote public health? Perhaps Jo, I'll come to you first in reverse order.
Well, I think, you know, there's a bigger conversation about tax generally and support, you know, what taxation is needed to support the sorts of public services people want. I think then there's a kind of more specific conversation about some of the sort of tax levers that are there and are being shown to be effective. So we know things like, you know, minimum alcohol unit pricing in Scotland has been shown to be beneficial. We don't have that in England at the moment. We saw that the soft drinks industry levy led to organised producers reformulating their products. So it led to the right result in terms of the sort of health impact that we wanted to see. So we know these things work. You know, tobacco taxation has been another example where we know that's been one of the things that has contributed to reduce smoking. So they do work. You know, there's clearly opportunity for more of that to happen. You know, and that's something that has to be a kind of, you know, that kind of comes back as well, I think, to the sort of public will and public support and recognition that these things actually are valuable in the long run.
Michael?
Yeah, two comments. Firstly, supporting what Jo said, if you raise the price, this is economics 101, consumption goes down. So it works, it really works. But we've got to look at the equity dimension, and we've got to take that into account all the time. That if you raise the price of healthy food, of unhealthy food, and it's food that's being consumed by poor people, that makes them poorer. So one just needs to be aware of the equity dimension. But the second, and Jo alluded to it, is tax more generally. We are a low tax country, 35% approximately taxation of GDP. The US is 25%. You will have seen the publication, I think it was ProPublica, it was picked up by the New York Times last week. Jeff Bezos, between 2014 and 2018, I think there were 2 or 3 years where he paid no income tax at all. And his wealth increased. Are you ready for this? In that 5 years, by $99 billion. He obviously got into the nervous 90s and didn't make his century, poor fellow. And if what ProPublica did is they looked at his tax rate look at the real tax rates, had looked at wealth accumulation, because what these chaps declare an income is totally arbitrary, and his effective tax rate was less than 1%. It was 0.9%. That lovely grandfatherly fellow Warren Buffett, who says he should pay more tax, I'm sure he should. His effective tax rate was 0.35%. So Nigel said there's a lot of money sloshing about, and there's the model, and again picking up Nigel's language, what I've just referred to is the model of exclusive capitalism. A small number of people accumulate vast wealth that they use. Jeff Bezos is going to shoot himself into space. They use this vast wealth that they accumulate. What Nigel's talking about, one is using wealth, as he said, £6 trillion in the pension industry alone, for good, to improve society, not just to improve the prospects of flying into space, but to improve society. And the second is everyone, so these fellows who pay less than 1%, well, the average American family pays 14% of their, on $60,000 of their income in tax, where it's probably higher in this country. So a proper rate of taxation that's fair would also make a huge difference.
Nigel, did you want to come in?
Yeah, I mean, I broadly agree. I mean, the tax on tobacco has made a massive difference to life expectation in the UK, off the scale, and has been hugely the right thing to do. All the examples on sugar say that it is the right thing to do, is to tax it in a totally different way. And so we do need to tax food in a way and communicate it. And clearly, you know, potatoes and carrots and all the great stuff, you can work both ways round, and so you can subsidize other parts. But this is such a real deep societal problem. Unless we take radical steps in the way that we price and signal to the community at large, you won't get the behavioral changes that you really need. And we've seen a massive drop off in smoking consumption. As Michael said, it's 101, which I used to teach, 101 economics many years ago. That has to happen, and we need a much wider public debate about this to make sure that actually this is the consensus. You know, it is tobacco, sugar, they're the same thing. We're going to do it on all sorts of climate assets, and you can see that happening already. And you know, in how we tax, you know, cars, I mean, we're doing away with, you know, the promoting EV cars and doing away with the combustion engine cars. And that's the right thing to do from a society level. We need radical plans for health that are the equivalent of tobacco and cars. And health, you know, tobacco was health, and we've got to do it again, big time.
Tina.
So just to add one thing, I mean, of course, you know, everything that's just been said, completely agree with. And of course, you know, it's building on what we know already works. For example, the sugar levies. I think there's more that could be done in other areas, like salt and you know, other sorts of drinks and things like that. But I think the big area that's going to be the spotlight is some of the work that we're doing with Business for Health. We're in the throes, actually, just right now, looking at the development of a business index, which will measure business contribution to health. And of the 5 priorities that I had mentioned at the beginning, in the Levelling Up Health report, food is a big area that's under the spotlight at the moment. We know that we eat a huge amount of unhealthy, you know, very ultra high processed food. And I know, and to Sir Michael's point, yes, absolutely, we know this is a massive issue and we don't want to exacerbate the health inequalities piece. But I think it is an area that absolutely needs to be in the public debate. We need more information and transparency about, you know, how the food system is actually really, you know, making us unwell and perpetuating this cycle of addiction to unhealthy food. So that's going to be a big area under the spotlight. So I think there's a lot to be done there.
Next question, which unfortunately maybe the last one we have time to take today, comes from David Hunter. So David's contention is that this government, like its predecessors, seems more wedded to an individual lifestyle approach to population health rather than tackling upstream social determinants of health. And that focusing on individual behaviour in that way, whilst it's part of the armoury, will be insufficient to tackle the challenges that Michael has outlined in his report. So I suppose the question to all of you is, do you agree with that contention? And if so, what levers are there to tackle the imbalance between that individual versus socioeconomic, social environment approach? Michael, I'll come to you first.
Not surprisingly, I agree with the approach I took in my reports. That we do have to address the conditions in which people are born, grow, live, work, and age. And everything Nigel said at this in this session has been music to my ears. We have the solutions. We do, you know, I and others have reviewed the evidence. We really know what to do, and there's a lot of money sloshing about. So let's not go down that blind alley of blaming people for their individual behaviours. It is a blind alley. I thought that it got knocked on the head in the 19th century as an approach to policy, but we have some people up to date with the mid-1850s still blaming people for their poor health. We know it's wrong. The evidence is against it. Let's act on the evidence, and we know what to do. There's money to do it. Let's now get cracking, and as Joe said, make sure we don't get it wrong by tracking what we do and being our own conscience to see that it's really making the difference we want it to make.
Nigel, I'll come to you next and actually wrap in another question that has come in specifically to you, which is, you talked in your remarks about the need to start doing. Can you say a bit more about what you will, as LNG, specifically be doing with Michael and with the local authorities that you talked about?
Yeah, I think I'll take on the doing, because I agree with Michael's point there. I do think privately a lot of the government wants to do the right thing. You just need, you know, I think we've got to figure out how we do the right thing and make stuff happen, and then create momentum behind it. I mean, as you know, we gifted £20 million to the University of Edinburgh to work on a huge bunch of research projects, and they've since raised another £25 million to work on healthy life expectancy and how to improve that, which I think is the right thing to do. With Newcastle, we gave £5 million to the city and the university to build the care home of the future. They were short, and we just said, actually, we'll top it up, and no strings attached. You get on with it, you do it, you make that happen. I enjoyed Michael's work in 2010, and sadly, in one sense, I quite enjoyed the 2020 version, or 2021. But actually, it's the change stuff, and we're here to help Michael and others by taking the science and the evidence and implementing it, and using our convening power, our access to capital, our brand name to really help facilitate. You know, we are one of the biggest house builders already. We did this thing on Less House Britain a number of years ago, and we've now become, in a very short period of time, one of the biggest house builders in Britain. We've got some, and all the stuff that my three fellow panelists have said, I pretty much agree with all of that. And we're here to support other people's ideas, if you like. You know, I didn't think of, you know, the clean, green and cheap, but actually implementing that. You know, I'm not there, you know, designing houses, but we've got clever people who can do that. You know, we announced the £4 billion project with Oxford University, and that's a 40 to 50 year project. You know, we did Manchester the other day. It's a 15 to 20 year, £1.5 billion. So there's tons of money for doing the right things, and we're just happy to help people who've got vision, but the scientific and the evidence to support what they really want to do.
Tina, so I guess that's the original question about what you think the levers for tackling the social determinants of health should be.
Well, I mean, I just see enormous potential and opportunity with just much better and effective public sector and private sector collaboration. I mean, we've got lots of, I mean, I think what I found, you know, coming out of COVID, and I do, you know, I do quite a lot of work in public sector, and I just think the antibodies were, you know, a lot of them dissolved between the working between public and private sector during COVID. We've seen, and speaking to some directors of public health very recently, you know, there's a huge desire to work more collaboratively with private sector, and obviously in these sort of more local place-based approaches to solve, you know, community problems. And of course, now that we're seeing the evolution of integrated care systems, etc., I just think there's so much more. It's the way that we do things in a collaborative way, and actually focusing more on the social impact that we want to achieve, I think is, and of course this is where some of the discussions, you know, certainly for Business for Health, and I know Nigel and John Godfrey and our partners, you know, seeing things much more broadly in the context of how we can get health within a wider context of ESG frameworks and investment. You know, I just think the whole thinking needs to change, where we can, yes, focus on where, you know, we can be proactive, but making sure that public sector, government are there to help those who are most vulnerable.
And Jo, I'll give you the final word.
Well, I think the really encouraging thing at the moment is the fact that we've got the engagement with the business community on this agenda. I don't think that would have been there 10 years ago. And, you know, there is huge resource available. I think what I would caution is that we really need to make sure that the business community do recognise this is about the conditions people live and work in. It isn't about individual level solutions. You know, businesses need to be creating good quality work. You know, we're not going to solve this if we have a company creating new apps for people to improve their mental well-being, but the cleaners going in to clean their office are still not being paid the living wage. So we've really got to see this as something that is about changing the conditions in which people live and work. And with the partnership of the business community on this, I think that's a really hopeful side to it.
Thank you, Jo. That's great. Very positive note to end on. Unfortunately, we are now slightly over the end of our time limit. We could have carried on with many more questions and discussions on this. So I hope you'll continue to engage with us on this. Just thank you very much to Michael, to Nigel, to Tina and Jo for joining me today for this discussion. Thank you to all of you for tuning in. Again, many thanks to Legal & General for supporting this event, and to the one coming up on Monday, which Bronwyn mentioned, where we'll have Peter Mandelson and Rachel Wolfe and others discussing what does levelling up really mean. And so it just remains for me to say thank you for watching, and please do come back to us again soon.